We're going to get started in just another minute or two. Like to give people a little time to get on. Good afternoon. I'm Lisa Kleinbub, Executive Director here at Regional Center of the East Bay, and I want to welcome you to our last of our community meetings for 2020. We will continue to have community meetings in 2021 and hope you will join us then as well. I will let you know that I'm going to start a PowerPoint presentation, which I'll go through with you, so you won't be able to see my face on the front screen. I also wanted to let you know that we do have translation in Spanish, and you can use the icons at the bottom of your screen in order to join that. So today we're going to talk about how to safely end 2020 and look forward to 2021. Based on reports to regional centers as of last Friday, and we're getting these reports weekly now from the Department of Developmental Services, there have been 4,645 positive confirmed COVID cases among people with developmental disabilities in California. There have also been 205 deaths. For the Regional Center of the East Bay, our population is about 21,388, and that number changes from month to month. We've had about 175 positive cases of COVID-19 reported to us. That number comes from last week, and I would say this week we've had another 30 new cases reported. We have had 3 deaths, and that is a very low number of deaths, and we're very glad that so few people have died in our community as a result of COVID-19. As of December 2020, our numbers in both counties we serve, Alameda and Contra Costa County, continue to rise. And the rise since the middle of November have been dramatic. Both of our counties continue to have many days of over 500 people confirmed positive for COVID-19. Our hospital capacities are extremely limited. Our ICUs are at about 17 to 18% capacity in our counties, but our neighboring counties have even lower availability in the intensive care units. And hospital beds are at pretty filled capacity as well. Our counties decided to go into the new regional stay-at-home orders early. They decided to go into that situation starting last Sunday night into Monday morning. And this limits outdoor activity, except for grocers who are limited to a 35% capacity. Most retail has been reduced to 20% capacity. All in and outdoor dining has been limited, and no gatherings are allowed either in or outdoors unless you are gathering with people who are from your own household. And that is a big change. I'm going to talk about the notify at the end of the presentation, but I wanted to talk about these regional stay-at-home orders because they really are quite different. There is a suggestion that members of the same household continue to maintain physical and mental health by safely going to parks, beaches, hikes, or bike rides with members of their own household. And Californians are encouraged to keep connected with loved ones virtually. Residents are required to stay at home as much as possible and minimize mixing to reduce unnecessarily exposure, while still being able to do important things like going to the doctor, buying groceries, doing pickup, takeout, or worshiping outdoors. The regional stay-at-home orders actually prohibit private gatherings of any size, and they close many operations except for critical infrastructure and retail. And they require 100% masking and physical distancing.
En todas las demás.
Along with that, I want to talk about hospitals and other visitation. People with developmental disabilities and other disabilities can have one person with them during inpatient or emergency room visits, but the person must follow all hospital protocols, including wearing a face covering or whatever mask the hospital requires. If you hear of a situation where a family member of yours who has a developmental disability is hospitalized and they are prevented from having a visitor with them or someone to assist them, then that would be a good reason to give us a call. We do advocate for that in some situations. Since gatherings are limited now to those in your immediate household, visiting or taking home family members living outside of your home is not advised. It's actually prohibited. So for those people living in licensed residential care who have a supported living arrangement, this holiday season is not the time for people to leave that situation and come home to be with their family, even though that is what typically we do over the holidays. I think that this is a really hard time, and I want to talk a little bit about strategies to cope during these holidays. And there are a number of places that have published some information to help us think about what's important during this time and what we can do. And I suggest there's some information on the California Department of Public Health website, but I also suggest a website called the Greater Good Science Center, which is out of UC Berkeley, that really talks about the way to deal with a lot of emotional concerns and has a number of good articles and suggestions for this specific holiday time. It's really important that you identify how you're feeling. The change in orders from the public health authorities has made everyone really feeling frustrated and feeling like we're really limited at this time. Figuring out your emotions around this time can make everything feel less overwhelming and help you think about how to cope. The pandemic has been difficult, meaning that things like COVID-19, other stresses at work, in relationships, may also be impacting how you're feeling about the holidays. It's important to take time to sort through your emotions and talk about them and think about them and consider them as we approach this holiday season. I think we all have to acknowledge the loss of what we're normally doing. While the holiday season is about thankfulness and celebration, sometimes they're hard for people under any circumstances, but at this time, as we're not able to really be in person with our loved ones, we have to think about that, and it's okay to grieve that we're not able to do what we have always wanted to do. And I think it's also when we're not able to do our usual celebrations, to really try to make the most of what we can do, to make our Zoom connections or what we do in our household extra special this year, in ways that we may not have done before, like spend more money on the desserts we're going to have over the holidays, and not always romanticize what we typically do, because as we know, holidays can still be stressful times even when things are normal. And it's also important for us to really focus on this time and what we can do right now. Practicing gratitude is something that people talk about. Making a conscious effort to regularly identify things you're grateful for. And they can be very small things. And I think that's one of the things we've been talking through with service providers as we're moving into this period. What can we be grateful for? Our health for many of us, the low numbers of COVID-19 in our community, the ability to have good food, good meals, even when we're staying at home, if that's possible for us. And it's really important to continue healthy habits. Exercising is really known to be a contributor to good emotional health, eating well, getting enough sleep, and reaching out if you need help. There are many support systems to reach out to. And some of this information came from Contra Costa's website, and they have a 211 phone number, as do most counties. And I'll give you some other suggestions for reaching out as well. Our essential services, which include licensed residential care, in-home respite, other personal care, in-home support services, and daycare, are continuing to be provided directly. And those need to be provided using proper personal protective equipment and social distancing to the extent possible. Services that can be delivered remotely are in alternative locations, such as speech therapy or ILS services via Zoom, should continue at this time. I think it is important for us to also, when we rely on essential services, when we rely on people for personal care, I say this to people who run licensed care settings, when we rely on employees to show up, it's important that we think through some backup plans. What will we do if someone gets sick? Are there other resources? Do we have other people who might be willing to step up and help out with additional hours of support for us? Very important to think through as emergency plans. Alternative service delivery is really rolling out now, and I think a lot of people are getting alternative service delivery via Zoom, getting supplies and materials for activities delivered to their homes. Our service providers are now being told what their monthly rates are going to be for alternative services, and they will start billing using those rates in January. That's just for the community, some knowledge about what is going on. They are describing the services they've been provided via a SurveyMonkey, and they will start sharing that information with us in January, along with their billing for monthly services. Other services that are an option for you right now are participant directed services. Regional Center of the East Bay has always provided our daycare and childcare and respite services via something called employer of record. And that's where we use an agency to pay workers that you choose in order to provide services. During the pandemic, the Department of Developmental Services has added additional options for participant-directed services. They don't go through our traditional employer of record services. They go through a financial management service, and they allow for additional personal assistance to be provided this way, for independent living services and supported employment. This is especially important if you are very concerned about bringing other people into your home, having fewer people providing services to yourself or your family member, and this can allow you to choose a worker for these additional services at this time. Other coping strategies, and I'm going to post on our website, there is a call-in service through the ARC and State University of New York at Stony Brook, which allows for people to call in and get some support via telephone. We have the Crisis Response Project, which if you call our phone lines after hours, you will get connected to. We also suggest that if you are concerned about how you're going to really do over the holiday season, that you give your case manager an email and let them know. We can connect you in advance to Crisis Response Project so they can identify you as someone who might need support during this period of time. Coping through outdoor activities and exercise. If you have children, you know that the governor did decide that playgrounds could be open during this regional shelter-in-place period. And as I said before, just really accepting that we can't gather in the ways we have in the past, and really acknowledging that and talking about it. What should you do if you need help during this holiday period? The Regional Center always has after-hours support. We will be closed during the holiday period on December 24th and 25th, as well as December 31st and January 1st. We will always have support available for emergencies and for other crises when we're not here. If you need help, call our main numbers. Ask for your case manager if we're opened. If your case manager isn't available, press 0 for the operator and you'll be connected to a supervisor. It might take a few minutes, but we will get someone to assist you. And we may actually reach out and have your case manager call you back. If we are closed, our main number has instructions for how to get in touch. You will call a number and we will get someone to call you back with assistance if it's an emergency. We will call you back. We will help. And so there's also, I would also encourage you over this holiday, if you or a family member has a situation where someone tests positive for COVID-19, please let us know. But please also, if you are in need of personal protective equipment in order to care for yourself or care for others, please let us know, because we do have additional personal protective equipment in store for people who need it due to COVID-19. I also want to talk to you today about the Department of Developmental Services Individual and Family Survey. DDS, who we contract with to provide services, is conducting a survey, and they want to hear from people served and their families about how things are going through the pandemic. And they want to hear about what's gone well, and they want to hear about whether there are things we can improve on. The survey is at www.dds.ca.gov. It's the first thing on their webpage, and it comes in multiple languages. It is only available online, and the last day to complete it is December 18th. So there's still a week, so please go and complete the survey and share how things have been going for you. And if there are things about the services you get from Regional Center or the Regional Center services directly that you want to commend or that you want to make a comment on. We appreciate that kind of input. What are we looking forward to in 2021? The vaccines. Yesterday, the Federal Drug Administration, Food and Drug Administration, not federal, it is federal, but it's Food and Drug Administration, approved the first vaccine, this is the Pfizer vaccine, for emergency use. And they're working on several other layers of approval so that it can be rolled out to all of the states and locally so people can start to get it. The priorities are set by the states, but in California, our first priorities are healthcare workers, those in health facilities, and IHSS workers, in-home support workers, are also in the first priority group, not the highest level, but probably down to in terms of the first group of people at highest risk. What we will see is that healthcare workers on the front line, primarily those in long-term healthcare facilities, as well as those who work in acute care hospitals, will be getting the vaccine first. Those living in congregate settings like skilled nursing facilities, where the largest percentage of people have died, will also be getting early priority for the vaccine. The Pfizer vaccine, which is the first approved, is required to be stored at very, very low, below freezing temperatures, and will be harder to roll out than some other vaccines. So, and it requires 2 doses, about 3 weeks between each dose. The counties will be ordering those, as well as large healthcare facilities like systems like Kaiser. We expect other vaccines to be approved shortly. Moderna is the next one in the pipeline, but there are many others in development, and we will be seeing different vaccines rolling out. If they've been approved by the FDA and they're showing high effectiveness, right now there's no thought that there's going to be a preference for any vaccine. The preference will be that people can get doses as soon as they want to. The state has a vaccine advisory committee, and I know the State Council on Developmental Disabilities is represented on that advisory committee. The organization that represents regional centers has also written a letter to the state task force, really requesting that the people served with IDD, as well as caregivers, be prioritized for the vaccine. In congregate settings and for people who rely on others to provide care, the exposure to others, the inability to social distance is very high. And so getting the vaccine as soon as possible to those who want the vaccine is very important. Right now, we don't expect there to be mandates to get the vaccine. There isn't enough vaccine. And I want to share that there are also many unanswered questions. The vaccines have been studied, but they were brought out without all the studies and all the time that is typically seen with development of a vaccine. We don't know everything yet, and we will find out a lot more about the vaccines as people are vaccinated. One of the things about the Pfizer vaccine is we've heard that people who have a high risk of allergies often do have a reaction to this vaccine. People with that kind of history are being monitored closely right after the vaccine is given. We will probably find out other things about the vaccines. So people have to make a decision about the vaccine based on their own personal health history and in some ways their preferences right now. There's also a long history in this country of vaccines being tested on populations, including Black Americans, without really taking into consideration their overall health. And so there is a lot of suspicion in many communities about vaccinations and whether they are ultimately good and really of benefit, especially to the individuals. And so we will roll these out, and at first we will expect that there will be no mandates. And what that means is you can expect that through the early part of 2021, masking and social distancing will remain a part of our culture. And that means if you're thinking about holiday gifts, masks are probably a good idea for the upcoming future. Dr. Fauci, who I think we've all come to respect as part of the National Institutes of Health, is saying at least late spring until we come to some sense of normality. We will see a slow return to reopenings. There's something called herd immunity, and really what that means, it's not about the cows that I have in the back of my screen today. It really is about having enough people vaccinated that even if the virus is in the community, there aren't enough people who are susceptible to spread it broadly in the community. There are also questions about how long the immunity from any vaccine or from actually having COVID-19 will last. So we're going to have to look at all of those questions. What are we going to see reopen first? As we've seen through the pandemic, schools for those with a need for in-person instruction will be prioritized. Schooling, education for young children will also be prioritized when schools start to reopen. We probably will see for school programs for younger children that teachers in those programs will be prioritized for vaccines as well. Younger children do not, and this does not account for everyone, do not account for most of the cases of COVID-19 and don't seem to really develop the disease as much as adults do. For our congregate type of day programs or community-based day programs, we will probably see them start to reopen, but starting with small numbers of people when the caseload rates go down and we start to have some degree of vaccination. We do expect that many people who are fragile are going to want to be the last to return to programs and schools. And these people may be the ones who have the most concern about early vaccination. We think with alternative service delivery that will continue as long as that is needed. And some of the parts of alternative service delivery that have been meaningful for people may be the parts that will continue. And I think that's something that as we go through the next few months, we want to think about what we want to retain, what has been positive, what do we absolutely not want to retain from that alternative service delivery. I think some people want to reduce the number of Zoom meetings, but maybe retain some of those in order to connect. The other thing that I think we're looking at on the horizon is that we expect by the middle of next year, June or July, I'm not absolutely certain of the date, that the self-determination program will be open to anyone who wants it. If you are someone who was not selected for the self-determination pilot, this period of time before June or July is really a good time to start thinking about it, getting information, and preparing to do a person-centered plan and prepare to be ready to develop your services and self-determination if that's something you're interested in. And so I think sometime early next year, we will do a few presentations for the community on self-determination. So those who haven't heard about it or who may be interested can learn. So we are ready when more people can enter self-determination in the middle of next year. And now I'm going to close the screen share, and I'm going to show you a couple of new things that I found online in at this time that I think are good for you to take a look at. One of them is Cal Notify, and this is something that came out yesterday. It is an app that you can put on your phone, and you download it, and you can do it on an Android phone or iPhone. And what it does is it tracks your location. And some people may not want to have their location tracked. But if you opt in and get a positive test result, you get some code that you share that you had a positive test result. And the app will look at who has been close to your phone in the last 14 days, I think it is, and will let them know that they've been exposed. It won't share who it was that they were exposed to, but it will allow people to know that they've been in proximity to someone with a positive COVID test, and that that person who gets that notification may want to get a COVID test and may want to quarantine in order to stay safe. So it's sort of an interesting new app. It started at the University of California campuses and was initially designed for their students, and now it is being rolled out to the state as a whole. And you can find, I'm going to put this on our website, so you can go there to also take a look at that. And then the last thing I wanted to share was one other thing about the holidays. And I caution you as we're going into the holiday season to be very cautious about what guidance you look at, because a lot of the guidance that is right now on, should be sharing my screen. Let's see. A lot of the guidance that is on different websites is talking about the rules before the regional shutdown. And a lot of the guidance says, well, it's best if you celebrate with your household, but if you're going to be outdoors, keep your gatherings small, outdoors and socially distant. Remember now that the rules are that you shouldn't be gathering with people outside your household at all. But I will also post this from the California Department of Public Health, which actually shows you what you can do and gives you some ideas about what to do to stay safe during this holiday season. And we will probably see almost the whole state on the regional shutdowns before the end of next week. So I'm going to stop sharing now. And I am open to any questions if you'd like to either raise your hand, or maybe I can't do that. Maybe I just have to take the questions in chat. But I'm open to any questions if you'd like to ask them, or if not, I do want to wish those of you who aren't going to stay on a very happy holiday. And I hope you stay safe and keep in touch with us if there's anything that you need during this period of time. We are here to help, and we will be available throughout the holiday season. So I'm going to, we can send to everyone who is on our mailing list for all of the apps that we have, and we will post them on our website as well. Thank you. I downloaded the app. It was very simple yesterday. It seems to be very easy to download and everything. So, other questions or comments or concerns? Well, thank you everyone for joining us. And let's see, what are the testing options available? So everyone can get a test, and it's actually fairly true that everyone can get a test pretty quickly in the state at this point. But what I am suggesting for getting a test is that you look to your health insurer and look at what options are through your health insurance. Both of our counties have multiple testing sites. There are also a number of testing sites through a company called Curative, through a company called City Health, that offer appointments and will bill your health insurance immediately when you take the test, and will help you with that. We are looking into for in our licensed homes in Alameda County and Contra Costa County, people are really required to test staff now once a month for each individual staff, and required to have a baseline testing for consumers. And so there are a number of companies that are offering saliva test and also self-test. And so we are working with on those, but a couple of the websites for the counties are very important. And I'm happy to put some of those testing links on my website as well. There are no specific COVID-19 testing sites for individuals served by the regional center. I do think the fact that testing can be done and is being done for people in their cars, that makes it a little bit easier if you have a family member that doesn't like to go into a lab. The other thing that I think is important is that if someone has symptoms and has other family members that have tested positive, we probably presuming that someone has tested positive is okay in terms of a quarantine. If we're working with, if we have a family member who really doesn't want to get tested or really isn't able to comply with getting tested. There is a question about applying for SSI benefits, and what I will say about that is please reach out to your case manager about that. That is something that we would have to work on with you on an individual basis, but we're happy to do that. It's a process, but it's something that we can help you find out about doing that. Thank you. Michi posted for me, Michi Toy, who's RCB on the screen there, posted how to connect with us on our website. I do want to just mention the DDS family survey again. Please complete that. And please share with us any concerns you have. We will get back with you about that. Okay, well, thank you, everyone. And I look forward to seeing you in the new year, most likely second Fridays of the month, but we'll play that by ear in the first few weeks. January 8th will be the day the governor releases the new budget for the next fiscal year. So we'll be keeping an eye on that as well. Take care. Bye-bye.